All right, y'all. So we've talked about anti-infectives, specifically antibiotics. We have talked about the medications that we use for tuberculosis. Now we are going to talk about antiviral medications. There are going to be two subcategories of antivirals. So we have to know a couple of things about viruses first, right? So viruses are microorganisms that require a host to reproduce themselves. So viruses are not going to be able to maintain life without having a host. So hosts can be humans, plants, or animals. And viruses are going to be smaller than other microorganisms. And the way that they're going to replicate are they are going to insert their genetic material into the host and take over the host cells. So they're not creating their own little cell walls. They're invading our cells, or those of an animal or those of a plant or whatever, invading those cells and then changing the genetic makeup and altering that. So for that reason, they're a lot harder to treat because we can't just the way when we think about how antibiotics work, we can go in, we can destroy that cell wall, or we can cause we can interrupt the making of the protein, we can interrupt the binding of the protein, we can do all of those things to be destructive. We don't want to just destroy our cells, right? Because they've invaded a host cell. So we can't just boom and hit it and destroy all of our cells that they have taken over. So when we talk about cells, or when we talk about viruses, these are where I want your brain to go. We're talking about things like the common cold, AIDS, cytomegalovirus, rabies, smallpox, chickenpox, shingles, influenza, and herpes. All of those are caused by viruses. So these are when we go to the doctor because we are ill, right? Let's just take COVID, for example. When you feel like garbage and you are running fever and you have a snotty nose and you have respiratory involvement and you just feel like garbage and you go and they don't give you any medications, they don't give you antibiotics, you're like, really, what? If it's not a bacterial infection, antibiotics are not going to do any good. And there's not when we're talking about antivirals, a lot of times we're going to let these viruses run their course unless they are life-threatening or unless they are they have a specific antiviral that treats them. A lot of times we're just going to have to let them run their course. Okay, so the way that the human body reacts to most viruses is by developing antibodies to fight the invading organism naturally. So I hate to keep going back to COVID, but think about it. It was an epidemic or a pandemic. So many people had it. Nobody had antibodies to the virus because it was brand new. So as time has gone on since 2019, people have been exposed to this virus. People have had this virus. People have had the vaccine. So for those reasons, we now have antibodies, and we can then fight when that virus attempts to invade our body. We can then fight back because our immune response kicks into high gear and says, okay, let me recognize this as foreign, let me let it not invade my cells, and let me push back a little bit, right? So when the body needs help to fight off a viral infection, we can use antiviral or antiretroviral medications. The choice is based on the type of virus infecting the patients. So when we talk about I got to go back to antibiotics, don't get them mixed up in your head, but when we talk about antibiotics, we can give a broad spectrum. We can give a broad spectrum antibiotic, and it's hitting gram-negative, gram-positive. Viruses are more specific. So we're not just going to give a random, you have a virus, let me give you some Tamiflu and hope that it works. They're not broad spectrum in that way. So we are not going to be able to treat with broad spectrum. There's no such thing as broad spectrum antivirals, right? They're specific to the disease process or the invading organism that we're talking about. So if we're branching out, so we have our biggest category initially is going to be drugs affecting the immune system, or immunological drugs. Underneath that, they can either support or they can suppress. We are still talking about supportive drugs, specifically the antiviral category. And then your two categories underneath antivirals are going to be antivirals and antiretrovirals. Okay. So antiviral therapy is the use of medication to inhibit the reproduction of a virus. Antiviral therapy is difficult because viruses replicate and reproduce and mutate rapidly. So we've kind of already talked about that. Unlike antibiotics that kill the invader, antiviral drugs eliminate the materials that the virus needs to reproduce and flourish, right? So that is how they're working. That is their mechanism of action. This can be done in several ways. The virus can be blocked from entering the host cell, thus preventing the implantation of the virus DNA, because remember, they need that host cell. They cannot reproduce without a host cell. Some antiviral medications target enzymes and proteins that the virus needs to replicate and function properly, or the virus can strengthen the host's ability to fight the infection. And that's essentially what your vaccines are going to do. They're going to allow the body to create antibodies to fight these invaders, right? Let's see what I was going to say. So another way viruses are stopped are by strengthening. I already told you that. So specifically, I got rashes all over my face right now, but y'all know I get a lot of fever blisters, right? That is a virus. Herpes is a virus, and so whenever I get that and I take medications such as Valtrex or acyclovir, it allows my body to fight back so that I do not, it's not necessarily eradicating the virus, it is allowing my body to fight that virus and take care of it itself. So it shortens the length. So if I take it as soon as I feel those, the herpetic lesions or the fever blisters or the, whatever you want to call them, as soon as I feel them starting up, if I take that medication, I can shorten, so I can prevent it if I take it on a daily basis. I can take 500 milligrams a day, or whenever I feel it begin, I can take 1,000 milligrams and I can kind of stop it in its tracks. That gives my body the ability to fight those viruses back. That is how your antivirals work, okay? That is what, chicken pox, shingles vaccines, all of those things give your body the oomph that it needs to protect against these things. Tamiflu and Relenza, those are going to be used when for the flu after someone has been diagnosed with the flu. Shortens the time frame, allows the body to fight back a little stronger. Let's see. Those are the main things that we're talking about in terms of antivirals. Antiretrovirals are an entirely different animal, okay? They are specifically used to treat HIV. They're not used to treat the flu. They're not used to treat herpes or, any of those things, the common cold, nothing like that. They're used specifically to treat retroviruses such as HIV. And I do have some videos that tell you a little bit more about retroviruses and how HIV works, so these drugs will make more sense to you. But retroviruses are different because they have an RNA blueprint. So we will, like I said, I'll have those videos so you can understand the difference between mRNA, RNA, and DNA. Those are posted. But the name implies that they use RNA to synthesize DNA, which is the opposite of the normal process. This allows genetic material from the retrovirus to become a permanent part of the genes of an infected cell. So instead of, see the best way I can explain this, instead of just invading those host cells, the virus then becomes a part of that cell. So as they replicate, that virus continues to replicate, spreading throughout the body, infecting your patient, more and more. So it allows genetic material from the retrovirus to become a permanent part of the genes in the affected cell. The embedding of the retrovirus into the genetic material makes it difficult to combat. Because again, we said we cannot just destroy all these cells. That's not an option. We can't just do a mass cell destruction, right? HIV specifically attacks the assembling T4 or CD4 cells. Because these cells are the body's defense soldiers, the host is rendered powerless to fight reproduction of the HIV. The term HIV is also used to refer to the virus's presence in the body. When the virus grows stronger and lowers T4 cell levels significantly, the patient then develops AIDS. So we want to keep them in that HIV, that we can keep them in that stage and not that acquired immunodeficiency syndrome. We don't want them to cross over. HIV is the virus that causes AIDS, but we can kind of keep them at bay. We can keep them at bay, and that's kind of the goal with these patients. Once they have AIDS, the patient begins to suffer from many viral, bacterial, and fungal infections. Therefore, the key is to prevent or delay the development as long as possible with the use of antiretroviral medications. Because HIV mutates easily, it is imperative that patients with AIDS take several medications according to a specific regimen. So going back to TB, the same way that we had to use multi-drug therapy to keep that disease process at bay, to that bacterial process at bay, we have to use multiple medications to keep our HIV patients from developing AIDS, from advancing that disease to AIDS. So let's see. I'm going to tell you, we talked about it mutating easily. The medications are classified according to where in the RNA or DNA process they are effective and include the following: nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, entry inhibitors, and HIV integrase strand transfer inhibitors. I don't necessarily need you to recognize, I need you to differentiate very much between antivirals and antiretrovirals. I do not need you to differentiate between the types of antiretrovirals, if that makes sense. So these drugs can be found in your book on, let's see, on page 340 of the new book. Keep in mind, antiretrovirals interfere with oral contraception. That's very, very important. They're used specifically for HIV. We talked about that. They cause, their side effects are fat redistribution, hypoglycemia, GI upset, and kidney stones. I'm going to show you some fat redistribution pictures in class on Monday. But these are the things that we need to know. We need to make sure that we're paying very close attention to those things. We're usually not giving them, it's a catch-22 with our pregnant women, right? So we're going to just need to make sure that we don't want baby to be born. Mom needs to know the implications of these drugs, and that needs to be a part of the planning and the education surrounding that. Notice that all of these drugs end in VIR. So it is important that you pay attention to that and you specifically pull out the medications that are only antivirals. And that way you can keep the antiretrovirals separate in your head. I feel like that's all I want to tell you about antivirals. Moving on in our anti-infective category, we have antimalarials. Those are going to be specifically to prevent and treat malaria. Those drugs we're going to place in that category. Let's see. Antiprotozoals are going to treat protozoal infections, and antihelminthics are going to treat the tapeworms, hookworms, roundworms, all of those things. So I want you to pay attention to those drugs. Notice that your antiprotozoals end in -zol. And let's see. I think that's all I wanted to know about that. Oh, and your antitoxins, those are going to be things like your tetanus vaccine, botulism, those kind of things, your Tdap. They are going to be used for exposure to toxins and at-risk patients. So that's why, when we keep our tetanus shot preventatively up every 10 years, but if somebody gets stuck by a rusty nail, we want to ensure that they are covered in that area. Just want to make sure that I've told you guys everything. Okay, that is it for the antiretrovirals, antivirals, and all of those other outliers as far as your drugs that treat, your worms and your other parasitic invasions. So that's it for this recording, and I will post it, and then I will give you one last recording for your other immunosuppressant drugs.